So we studied about research processing. So what is research processing? We studied research. Okay, we are finding out something new, or we are finding out, we are working on the thing which is already existing, and we want to find out new innovation in that. So we want to implement something which can enhance its good advantage more, or like it can. Previously we had that manual thermometer. We were calculating, putting in the arm, and we were just trying to calculate. But now it is like digital thermometer. It is working much better than that. So now sphygmomanometers also, now digital thermometers, digital sphygmomanometer is available to you. So research processing is what you want to work on. What is the question in your mind? Okay, I will give answer to only the one you will ask me the question. Okay, so whatever question is in your mind, it will be related to your interest, it will be related to your previous knowledge, it will be related to your query, it will be related to the benefit of society or something. So first of all, research process is what? Asking a research question. Then we will try to find out the relationship. Is it a relevant or not, a relevant research or not? Is it a relevant literature or not, on which I am going to work out? Okay, we had taken an example of cardiopulmonary resuscitation. Yes, it is effective because we can save the people from dying. It is decreasing the mortality rate in the ICU or in the hospital sectors. Next is what? We will formulate an hypothesis. Very clear. Hypothesis is a part of assumption, or we are predicting something, but its definition is totally away from assumption. Assumption means what we are predicting. Prediction is not something we will prove it. Alright. But in hypothesis, you are going to prove it out with an evidence. And for that, you will have to develop a planner. You will have an infrastructure, or you will have a blueprint or a map of it. Just take an example. You want to develop a building. Okay, educational building. What you will have in mind? You will have to develop a blueprint of it. On which land, how much square feet area I want to develop that particular educational sector, and for how long I will make the people work over there. It is a planner of how much years. All these things I will keep in mind. I will try to see, I am having an education sector, what kind of samples I require is, yeah, I will require teachers, I will require clerk, I will require peons, everything. I will have a complete planner for that. Collecting the data of it. What data you will collect, you will survey on something. If I'm developing a plan to develop an educational sector, I will find out that how much budgeting it will require, how much successfully the people in the education sectors are. Is it a good business planner to develop an education institution or not? Or is it in the benefit of like society or not? We exactly know that education is something, it will work throughout. We want to literate the nation people. So we will try to that it is a worthy research I am going to do. So we will survey on it. Okay. Next is analyzing the data. Okay. How we will analyze? Yesterday I gave an example. I want to evaluate the performance of a student. I will take a test, and I will analyze in a calculative form. I will judge the marks of the person. Yeah, he has scored good marks. It is above 80. It is below 50. Then it is very poor, or it is between both 50 and 80. Then it is moderate level of performance. Evaluating the hypothesis, whatever my prediction was, I thought that yes, educational sector will definitely be a successful part in business, and it will really in the sake of society. So I have to prove it out. So how I will do that? I will just collect the data, I will survey it, and I will find out that yes, most of the education institutions are running well. They have a particular curriculum developed, and yes, students are getting a bright future. And if the students are in bright future, then definitely nation will have a very good potential citizens. Okay. So lastly, what you will have to contribute towards the new evidence to literature and begin again if this hypothesis has not proved. Okay, how it will not prove? I give another illustration that if you are getting marks, I thought that 70% of your students will score very good marks. I thought my teaching was quite effective. So 70% of students will get score above 80% of marks. But when I am evaluating this, I am analyzing this, I found the opposite result. That means I got a null hypothesis. Means my students were 70% poor, they were scoring below 50%. So in that case, what my prediction was, I just rejected that my students are not having high qualified knowledge, but they are having a poor. So I am proving this. That's why it is an hypothesis. It's not an assumption. Keep in mind, assumption is what you are not going to prove it. You are not going to bring out result of something. Okay. So if research process, this planner is clear with you, that means your process is clear in your mind. Fine. So you will develop a theory on this basis. What will be the theories we'll study in next class. Now let's study about this. Might be it will be a bit blurred, but just understand. I will search on something what the interest part of me is. I am a cardiac specialist, so I will search, I will try to effort on something related to my subject. My interesting area is like cardiothoracic, then I will work on that. And what I want to find about that, I will have a clear planner in my mind. I will have a clear picture. Then I will find out a research topic. First of all, what I did, I am searching something on the cardiothoracic something. So I will develop a question from that topic only. Alright, so I will go for the research topic. Next is, I am already aware about of this topic or not, or it has to be known for me. Okay, I am a medical surgical personnel. I am aware about medical surgical nursing, but I am not totally aware about coronavirus. If I want to study about that, I will define that research problem. Yes, the right problem is what? A new problem has generated. This is a coronavirus. Its issue is it is leading to high mortality rate in the society. So I am trying to work on that, but I am totally unaware about that topic. But somewhere I am relating to my subject. That is, it is related to something medicine or something, it is a medical condition. So we will search on that. So the researcher believes their practical experience and a review of literature will influence these stages. Okay, then lastly, we'll develop a research question. If you are clear with your topic, yeah, I want to work on cardiac, I want to work on CPR, I am clear with that. Then after I will define a problem that yes, previously staff nurses were working on ABC, so the survival rates were very poor, but now it can be converted into ABC, so that will give them more survival rates. So I had a set of questions that on whom I am going to study is the PHC nurses. I am having a setting, definitely I'll get nurses in the hospital sector, and my problem is to work on CPR, that is a new protocol CPR. Okay, this is what clear? This is the first stage. Then what is one question that emerges related to your topic of interest? I said that cardiac is a vast subject. I cannot work on multiple subjects like myocardial infarction, then I cannot go for congestive heart failure, then I cannot go for valvular disorders. I will find out what is a particular part of my interest. So I have learned something about CPR. I am licensed personnel about that. So I will try to find out the real problem that is existing in the society. Okay. How can you answer your question? I am in search. I formulated this question, but now I will search a answer for it. But I have to struggle a lot because if I am assessing your knowledge, I said that I am assessing your knowledge that they were very good knowledgeable person, they were excellent at their performance, or they are having moderate level, or they are having poor level. How can I get the answer for this? Only if I am having a clear picture, I am having a clear planner from where I will get my answer. You cannot go and ask that today's topic I am taking research, and you will go and ask your some people or a friend who is lay person about this nursing, and you will ask, he might be of totally other sector, and you will ask that what it is, like what is cardiothoracic nursing. You will not get an answer. You will ask me, ma'am, you have taken this topic, Ma'am, can you explain that? So I am getting a clear vision that the person who is expert in this, who is having some kind of knowledge about this, where I am going to work. Okay. Determine how to conduct a research. Okay, so you will have a hierarchical structure. Okay, a step પછી a step. This will afford for the hierarchical or systematic process. Keep in mind you have two things, scientific and systematic. Okay, scientific because you should have a rationale behind what you are studying. It should be fruitful enough to the society and you yourself. Another thing, it should be systematic. It should be in a like hierarchical manner according to the stepwise. I gave you an example yesterday was of alphabet. You learn first alphabet, then you will go for a spelling or a terminology. Then after you will skip to, you will switch on the statement formation, and lastly you will conversate easily. What information you need to answer your questions? Okay, that again a big question. What kind of things you will find out? For example, again I gave you, I'm working on developing an educational institution. So what kind of information I require? Yeah, how many candidates I have to make them work? I have to employ, how many employees should be there in my sector? What will be their qualification? What all departments I have to develop? What all labs I have to develop? What are the classes I have to segregate? All this I should have in mind. What all equipments I will require in the class to make the teaching comfortable? So this is what you will require, some kind of survey, and information collection should be possible only if I'm making a tool. Okay, I have a planner, I have a checklist. Yesterday I gave an example that if you are seeing the practice of a student on CPR, you will have a checklist that yes, he started and compression pass, then he is going for the airway, then he is going for the breathing, and in between while he is calling for emergency. Okay, whatever things has been worked, it is in a hierarchical form, but I have a checklist. Then only I can give the marks. Okay, so then only I will get an output for the thing I want to study. Okay, what did you find? Okay, if you are finding out something with the relevant, then it's okay. If you will not get a clear answer to your question, then your tool is not proper. Okay, so you have to gather the information, you have to analyze them, and what you are finding it out is very necessary. And how will you write up to whatever you have found out? Okay, but the problem is whenever we are not getting a proper result of it, I cannot like go with the dissertation or the publication. I said that the things are being proved by the experts. If I am just going with the book creation, okay, I have to get it clarified that there is no error in my book and it has been approved by the expert, then I can publicate it. But in case if I fail with that, I'm not getting an expert review, then in that case, it is a failure. It is total failure of my work or whatever I have worked on. So this is what step by step, as like already discussed, defining a problem. You have to recognize one of the problems you want to study on. It should be single out of the problem he wants to study. So you have a vast area of cardiology, but you are studying on the area of interest you want to study. Okay, there are two steps involved in research process. You have to understand the problem thoroughly. Okay, so might be American Heart Association team might have undergone some kind of finding that yes, these people with the ABC were not having survival rate because their brain were not getting or vital organs were not getting enough of blood supply, and that were interrupted because we were proceeding with the airway first, and otherwise they gone with the like intervention of giving compression first in some of the patients. So they found out the meaningful or there was a fruitful result in that their survival rates increased. And rephrasing the same into meaningful terms, you considered the problem, but you have to formulate the statement for that. So first work, whenever you are undergoing a research, you will formulate a statement, but before that you have to go under a research process. You have to find out a relevant problem on what you want to study, and then you will analytic point of view, yeah, means you are going to prove it. So you will work on that. And lastly, the best way to understand the problem is you have to discuss with your own colleagues whom we are having the same expertise in a manner. Okay, whenever I went for the study, I had asked my guide who are expert enough, or although I can go with my colleagues also who are friends of me, I asked them, yeah, did you study something on cardiac? You are finding the patient who are undergoing cardiac surgery and they were suffering with the problems. They said, yes, definitely, it is a good like sector you can search for. So I am getting an output and I am understanding the problem that I am on a correct pathway. Okay, next second step is extensive literature survey. You will find out all the survey researches are been for example, research to be conducted on the extensive survey. You have to get some articles from the other sources, like you will get articles previously produced, manuals, journals, company records. I said yesterday that census data collected previously. All this will give you a good like literature review, and it will help you that yes, it has been proved like fruitful, or it is potential enough to study on this research. Again, it is an integral part of entire research. Okay, research review, literature review. This is my next part. I'll make you study. Literature review is till the end. You will keep on finding. Okay, if you are just taking notes of me, I have previously made, okay, on cardiac system. So you will find that, yeah, ma'am has made some notes and this is fruitful enough. You're referring that. But simultaneously, you will also go for some other books also. So that is what you are getting some kind of literature. You are getting some kind of articles or resources to study. Okay. So this is contributing for the research process or the next step. But it should be focusing on your research problem. If I am having a study on CPR, I will not go for that coronavirus. Okay. I will not search the articles on coronavirus. I have a focus to study the cardiac system. My test is on cardiac system. Then I will not go for studying the respiratory system, because next day test is of cardiac system. So I will search all the resources, all the PPTs I will gather of cardiac system, not for the respiratory or any other system. Okay, you will improve your methodology by that, because you have to develop a planner. Okay, you might undergo, just take an example, like if you want to develop your educational institution, you will go with the survey what other institutions have developed in their educational institution, and then you will try to develop, or you will make a planner with the architects for the new betterment. You will broaden your knowledge. Okay, you will expand your knowledge. You will study from my notes. You will get in knowledge. You will know how to make your own notes, and you will be easier. You will learn easier methods to segregate the notes. Then lastly, it is a conceptualize of your finding. Okay, whatever your finding is, you are collecting a data, you are putting an effort to finalize and generalize it, and you will have a fruitful result only in the case if you are getting a normal or non-manipulative finding. Okay, sometimes what I want to get a clear result. I want to clear my student that he is having just 35 marks. I want to clear my student with the 38 marks. I have to manipulate inside the mark sheet. Okay, what I will do, I will just try to gather some more information. If I can give some more marks, that is manipulation. So real marks were 35 and I am trying to manipulate it. Okay, so this is what the manipulation will interrupt. We will form an objective. Okay, before proceeding with any of the tasks, you should have a very clear goal, what you want to attain from that. Okay, so that's what it is. You have clear goal, what you want to attain from your study. It is really important. It should be specific enough, and objective should be listed again in two headings. That is main objective, what is your aim, and subjective objective. Okay, the main objective is what? It is an overall statement of the thrust of your study. It's all the statements, like it will have an association and relationship. Okay, what is association? For example, I yesterday have discussed with you that I am finding out CPR practice in you because you are a paramedical student or you are a nursing student. You might have certain knowledge on that. But if I am I'm going with a lay person in the market, or I'm studying that on an engineering student, then it is not worthy. So I'm having an association. I'm having a relationship. Okay, dependent and independent variables we'll study in detail. That your education, your topic interest is making effective with the like study or the problem you are undergoing. So that is affecting on that. Okay. For example, another example, very easy example. Can I ask a 2-year child that what is regarding the Prime Minister Modi, you speak out something. Will he be able to? I have to see his age criteria. If I'm asking a 8 years old, yeah, he will give a brief description. If I'm asking a college student, he will give a very good speech on Narendra Modi. Okay, so this is what age factor, this all the demographic factors, your qualification, your locality, you are staying in urban or rural, all these are having relationship with the thing which we want to find out. Okay. Next, step 4 is determining the research design. Very important. It is, I told you, this is what a blueprint. Research design is a blueprint. You are developing a map for it. You are developing a master plan. How we can see that master plan? Okay. Whenever we are starting with your curriculum, okay, I am developing an MRP CRP, that is master rotation plan and clinical rotation plan. Yeah, in this month I should give them theory of the medical surgical nursing. Then after I will be giving them clinical portion for practical experiences. Although it is clear, and we will have number of alternative research designs. Okay, that we will find out from this chapter. The choice will be largely depend on the research purpose. We discussed yesterday that I am just going for a kind of short survey. So it will be just survey study, but I want to experience something. I am starting working on the patient who are going under cardiac arrest, and I want to check their survival rates with my new CPR protocol. So this is a kind of exploratory. We want to experience something. I am experimenting something. Okay, descriptive is something including just a survey and we are calculating the result. And causal, again, you are finding out with the cause and effect relationship that we study this detail. Okay, let's study in detail. Descriptive study, what I explained, it is undertaking the organization to just describe the characteristic of group, employees as for example, age, education level, job status and length of service. But here in informal manner, yeah, descriptive, you are maybe coming in direct contact with the person and you are collecting. You might be very formal enough because you are working with a professional person, you are collecting something with the professional person or an organization, then you should have a very ethical, very formal kind of data collection. But in explorative studies, the study of collection of data in informal manner, or it can be unstructured. Suddenly I am going somewhere and I just found that, yeah, this place is quite dirty and the municipal corporations are not working on this area. But in other place, I am finding out, yeah, it is a very clean. But it was what? It was informal. I didn't invaded the particular official part. Okay, so I do not have to investigate with some of the officials or for health personnel or anyone else. But this was what I informally collected. And I have an unstructured plan. What I saw, I just collected. But above in descriptive, you should have a planner for this. Causal means you will inquire about to know the cause of one or more problems. I am finding out what is the reason for this coronavirus. I am searching the cause of it. Okay, so whenever you are doing a kind of study that you are finding out the cause for it, it is not trying to bring out the result, but at least you are bringing the result by what? You are finding out the real cause, real etiology for that particular thing. Yeah, now research design is concerned with what? Sample of study, sample study. Okay, what is sample study? I just said that I am not able to take a good data collection with the lay person about CPR, but I can collect it from you because you are the quite good sample that you might have the knowledge regarding that. So I can collect that sample and I can work on that. Population size. I cannot work on whole over Indian nursing students. Okay, they might be in thousands, they might be in lakhs. I cannot work. I'm a single person. I cannot go and reach every one of them. So I have to make a particular size of the population. Means these much of samples I can study. In on 60 students, I can make a survey, but it's not possible for me. So in research design, you have to keep it in mind. Okay, next will be the sample size. Population you have already decided, but you have to undergo the sample size also. Next is data collection. Whatever data and tools you have empowered, you have made, you have to go for that, you have to create that, and you have to identify through the questions or interview methods. Okay, the research process is having a fifth part is collecting the data. Okay, whatever the data you have available with, but here what it is, you are collecting from everywhere, you are collecting from journals, you are collecting from the data which is available in the government sectors, technical available data, books, magazines, hard copies, then records of statistics, historical documents, everything. How will be the data collection done? By personal interview. I will ask some of your students the questions. I will make them sit in front of me. I can find out, yeah, they are having good knowledge, but some of them are having poor knowledge. On their responses, I can get the answers. By the questionnaire, I am making some questionnaire. I am asking some MCQs. I am asking them the open-ended or close-ended questions. So that will help out. On telephonic conversation, many times I'm like it's not feasible in pandemic situation that I can call every individual who is coming to get recruited in my institution as a nursing tutor. I can conversate from telephone. I will just ask them certain question on telephone. I can just judge their review and I can bring out the analysis of that. Lastly, it is what? Qualitative and quantitative analysis. I said that it can be in a figure form. It can be a value that is coming. I am just calculating the mark. That is what? Numerical values. But I am not predicting the behaviors. I cannot calculate the behavior of a student. If I am judging for the attitude of a student, that is only possible if I am having a qualitative analysis. Okay, so it is not discussed or it is not decided. Okay, lastly, we have to evaluate the information which we have found by compiling it. You will analyze your notes and you will break down the notes into topic and themes, and then you will look for the holes in your thesis statement, and we will see what information is still missing. Alright, this is what you will need all the things. It is still not enough to collect all the data. So this is what about the research process is. In analysis and interpretation, okay, I have analyzed the things. I have collected that, yeah, 70% of students were having good knowledge and 30% were having poor knowledge. But again, I have to interpret it. I have to get a central step for that research process, that I have to summarize the whole data collected, and then I will bring it in a summarized form that yes, majority of students are having good knowledge and minor students are having poor knowledge. So this is what I am interpreting in the research for broader and meaning of the research finding. Okay, so my research hypothetically been proved. Okay, what I had predicted in my research, that yeah, my students are really brilliant. They will, most of them will be succeeded with 80% scores, and they did scored. And that is what I found it by the analysis of that data collection through the mark sheets. Okay, and interpretation is lastly what? Like 4 of my students are the university rankers and others are all on distinction. That is, other 60% are on distinctions and others are on the average category. So that is what my interpretation, 2-line interpretation. Otherwise, when I was collecting the data, whole bunch of papers were there with me. Okay. Lastly, execution of project. Whatever I have worked on, I have to project it out. I have to systematically, I have to give it a code. I have to orderly organize it, and I have to really find out the real survey as much as realistic performance I have to find out. So accuracy is very necessary in this. So I will go with this I was taking a sample of nursing students from only knowledge institution of nursing. I found that 70% of having good knowledge, but in other college they were opposite of that. So I have to find out the accuracy. I cannot concise with a particular setting. Setting means what? A particular place only or particular institution only. I have to go for another institution also. I have to generalize my study. Okay, so marketing the research. Lastly, what? Once you are done with your research, you have done all the things. What will you do? You will give a report of it. You will communicate properly the result. Very important. If you are getting a result for the health sectors, okay, you have found that these much of people are suffering with coronavirus. Okay, in our locality, thousands of people, from thousands of people, 200 people are suffering with COVID. Okay, so you have to give that data to the health personnel or CDHO. It's very important. Okay, so this is what you will prepare and present the final research report without any errors. Okay, so this is what the last thing. So this is what the conclusion is. Good quality research will require a research to follow the scientific approach. And researcher must follow the scientific method which we discussed. We have to identify the research gap. Because we knew that ABC protocol was being followed because they were not being trained. The PhD nurses were still in the historical period. They were practicing the same thing. They do not go for the advancement. Then you have to write out for the problem statement, you have to outline that research, you have to make a planner, you have to create a design, because design is what? Your blueprint. Okay. And lastly, it will depend on certain kind of specific research question. Overall objective should be made. Your goal should be set. Yeah, I want to develop this big institution, but I am having no goals. Either I should develop a hospital or it is a educational sector. So I have a goal that I want to go for the educational sector, that too in the nursing. So I will develop that unit only. And decisions like choosing the data collection method, it's on us. And simple technique I will go through. Because if I'm going for the complicated, it will be really very difficult and it should be feasible to the researcher. I'm giving you a questionnaire, okay, and it is not understandable to you. Okay, if you are not undergone the CPR training, then you cannot understand that questionnaire. So I have to give a very simple questionnaire to you that you can understand, and I am also comfortable with that. Okay, so this is what about the research process. Students, we are ending with the research process. Tomorrow we'll go with the research problem. So please, if you are finding any kind of problems here, you can ask. Okay, thank you.